ready to roll?
Ready.
All right. Can you please introduce yourself?
My name is Julia Frechtman. I'm controller and HR manager for RZ Enterprises. It's a construction company. I've been with the company for 5 years. At the time, the company, even though they match certain amount for the employee, even for one employee, it was a few $100 a month out of pocket cost. It's absolutely impossible to afford.
The cost had almost doubled for the employees, and so we were faced with paying an enormous amount of premium for the employee. And on top of that, they were also paying a lot of premium in addition to having an enormous deductible. So I decided at that point we needed to look for alternatives. We had made the decision to try to do something different. I told Julia what I wanted to do was have a couple of people test it out, see how it went, and then see how it goes for a year. And I think we waited a little over a year to make the final decision. But ultimately, we made the transition, and the rest is history.
They were hesitant, had a lot of questions, didn't understand how easy it is, didn't understand that it actually gets covered. The employees that stayed with it from the beginning, I believe probably within 6 months they already understood the benefits of it. Our employees actually don't want to go on traditional insurance anymore.
Just the experience I had when I had COVID, for instance, the fact that we were able to communicate with someone, get the prescriptions in, get the prescriptions the next day, was amazing comparatively. Covering 100%, we're paying a third of what we were paying before. You know, we're also entrenched into thinking everything has to be done a certain way. This is a new concept, and again, don't make the mistake I did and wait a year and a half. I feel strongly that this is a tremendous alternative to traditional insurance. It's particularly for people who are, employers as well as independent contractors and so forth that are having to pay huge amounts of money for any sort of health coverage. I would say don't think twice about it. It works as advertised.